This presentation will deal with the imaging of ankle and calcaneum. The calcaneum is in the plain X-ray will be taken as a model for bone diseases. This is the typical normal, and this is a radiolucent area or cyst-like pseudocyst of the calcaneum, which is again normal, and this is coalition. This is talar ankylosis, tarsal ankylosis. This is a calcaneal pitch formed by a line along the plantar surface of the calcaneum. This is the line drawn along the plantar surface of the calcaneum, intersecting the floor. Should be 20 to 30. Less than that is considered abnormal, as in flat foot. This one is 14 to 36. This is starting or going along the longitudinal axis of the calcaneum, of the talus, and intersecting with the floor. It should be 14 to 36. And this is one of the important angles, which is called Bohler angle. If you draw a line from the anterior talar process to the posterior calcaneal facet, and another line from the posterior calcaneal facet to the superior calcaneal tuberosity, this line and that line, if intersecting, will produce the Bohler angle. A bony protrusion here is considered the point, and a bony protrusion there, the summit, this area is considered the point here, and that one is the third point. So just you would draw two intersecting lines. The intersection of talar and the calcaneal longitudinal axis, if you draw along the decrease this one and that one, it should be 25 to 55. Hind foot deformity is indicated when there is change of this angle. Decrease is indicative of equinus hind foot deformity. That means that that one is a transverse one, and increase means that this is the calcaneum is showing some deformity. 75% of calcaneal fractures are intra-articular and 25% are extra-articular. It may be vertical, horizontal, or tuberosity fracture. Intra-articular are subtalar, involvement of the subtalar joint, and calcaneocupoid joint involvement, and may be undisplaced, displaced, or comminuted. Again, fractures of the calcaneum are usually intra-articular, but extra-articular also exist. It could be involving the tuberosity, so whether vertical or horizontal or avulsion, and it could be undisplaced, displaced, or comminuted. This is a tuberosity fracture. Here we find this one, should be here. This is a tuberosity fracture. This one is there, and this is a stress fracture here, and this one is another similar lesion, but it's called, this is a bone island. So bone island, stress fracture, and bone infarct all are seen producing bone sclerosis. But the difference is that in stress fracture it is usually reaching the surfaces, while bone island is within the bone. Now here we find destruction and new bone formation, the sclerosis with a skin ulcer. This is a skin ulcer. This is typical appearance of infectious process with unhealthy periosteum and callus formation. This is osteomyelitis. Again, there's another osteomyelitis. Third osteomyelitis, sclerosis, destruction and compression with skin ulceration. Sclerosis and destruction, unhealthy callus. If you look here, you will not find any soft tissues. That means that the bone is eroded, the skin is eroded and the bone is exposed. Now here there is something different, in which we get increased girth of bone. The diameters of the bone are increased, and there is marked increase in the in the bone cortical outline. This is of course Paget disease. Here is a simple cyst of the calcaneum, but if we consider this bulge and the eccentric location and the interlacing septa inside, we should put ABC as a possibility. This is calcification within a lipoma. It's very rare. And this is sclerosis surrounding an osteoid, osteoma. The intense sclerosis here has central lucent area or nidus. Fibrous dysplasia involving tibia and fibula, talus and calcaneum. This is polyostotic fibrous dysplasia. And here we get the malignant process showing the irregular calcifications within the soft tissue component of the tumor, and the matrix here is that of chondroid origin, seen as lines, curved lines, flecks, mottling and rings, and this is chondrosarcoma. Here we have the patchy sclerosis, which is usually seen in osteosarcoma. The matrix is bony. And here we have the no matrix malignant tumor invading the soft tissue, causing marked thickening. This could be any, all with non-specific matrix should have the list of round cell tumor in the differential diagnosis, and the list of round cell tumors include fibrosarcoma, reticulum cell sarcoma, and histiocytoma or histiofibrosarcoma, malignant fibrosarcoma. These are the some examples of the round cell tumors which can involve here. In neuroblastoma in the baby can result in such sclerosis, but there is some destruction, of course. And this one is prostatic carcinoma, producing multiple sclerotic foci. And if you have this one, we call it high arched foot, and this is characteristic of paralysis or polio. Neurofibromatosis can produce soft tissue masses and at the same time indentations on the bones. This is neurofibromatosis. This type of involvement is the involvement seen in rheumatoid and Reiters. It it is usually posterior. In rheumatoid and Reiters, it is usually posterior, while in the inferior margin, it is usually psoriasis and acromegaly. This one is ankylosing spondylitis, in which you can find the bone spurs all are prominent. All bone spurs are prominent, even posterior and inferior. Here, this one have the punched out erosion of Gouty arthritis, and this is a reversed, this is a spur formation of degenerative calcaneum. And here is the neuropathic joint, or the Charcot joint, in which you found the density increase, the destruction and deformation, and the disorganization of the joint. In diabetics, or indifference to pain, or tabes dorsalis, any of these can produce neuropathic or Charcot joint. This one is the increased soft tissue thickness occurring in acromegaly, and this is the calcifications occurring in the same process. Here we find that soft tissue calcification or soft tissue ossification can result in cases of chronic renal failure or pigmented nodular synovitis. In HYPERPARA, it is the same. You can find some increased soft tissue density, similar to the one before. But here there are the famous well-defined erosions of pigmented villonodular, and here is the HYPERPARA with the osteoporosis and nerve joints. In the MRI, you can check for components, the ligaments, the tendons, osseous structures, and the neurovascular structures. This will be in another presentation.